Good morning. This is the second part of my occupational program. This is Dr. Tom Peters. I'm introducing my occupational program to enable severely mentally ill clients recover from mental illness in psychotherapy. So this program enables psychotherapists and clinicians, psychiatrists to reach their organizational goals and help clients recover. So the characteristics of the work program are as follows. Structured volunteer activity for nonprofit organizations or for public benefit purposes. I have various contracts and various options to engage those who come to our program in work activity, and it has to be in a group. Work groups with team leaders, case managers, and it has to be light labor, not a sitting and just group discussions type of activity. Group discussions about activities, which means only about the work, not about personal issues. That belongs to psychotherapy. Weekly seminars on the benefits of group work, work and recovery, generational issues and changes in society, and so on. The clients will encounter a multicultural environment in this program with some team leaders who are younger. It could be a different culture group, bilingual, English-Spanish bilingual, who could work with English-speaking and Spanish-speaking clients from the Spanish-speaking world, because we want this program to be international, and we would like to see clients come in from Argentina, Spain, as well as the United Kingdom, or Sweden, Norway, Hungary. Next slide. The goals of the program. Increase positive self-talk and decrease negative self-talk. Well, one critical issue in depression is the self-talk. Self-talk, negative view of the world, negative view of self, and these negative thoughts are so relevant that eventually a very severely depressed person who contemplated suicide before will think about ways of ending their lives. We want to interrupt it through the work program, the occupational program, because when you are focused on work, what you have to do, you're not going to be able to stay focused on these thoughts about suicide, and it takes time for the brain to readjust. So that's why the program would be a 12 months program, 6 to 12 months. And the other goal is to increase occupational capacity and potential for active aging. While the goal of this program is to enable psychotherapy to work better, the scope of the program is much larger. If the client is middle-aged and they suffer from depression, they receive treatment for probably less than 10 years, but could be 5 years, or they experience depression long term. You know, the body is aging, so people respond in a different way to life when they come out of depression and they are 10 years older. So we would like to enable them to be more active after they recovered from depression, for instance. So there, in the goals, that the way I set it up, and the way Europe set up the European Aging Index, there is a very strong overlap, which I will explain. Inclusion criteria. Primary physicians, clearance, psychiatrists note regarding severity of mental illness. It cannot be too severe. It cannot be that people have to go to the hospital. This is not an alternative for hospitalization. Psychotherapists, clearance for feasibility of labor activities as behavioral therapy goals. So the specific activities that will be there are required, or we would require your therapist, if you already have a therapist, to incorporate it in there if it's feasible for your life. You know, we have to discuss that. Exclusion criteria. If somebody has a very serious psychotic episode, or hearing voices, hallucinations, we can't work with that. Severe alcohol, drug use, we can't work with that. Severe physical problems that make the program, participation in the program impossible, that's a limitation. We can't accommodate for that, you know, at this point. Severe suicidality Correct. We cannot stand guard over everybody at every minute of the day. Inpatient treatment is indicated. Yes, it's okay. I tested the program on myself, as I said that. In the first picture, it's a picture of me in 2016, and this is the second picture is November. I will justify what I'm going to say with this next slide, which is my weight change. I developed a very serious gastrointestinal condition after gallstone surgery, and it's almost like being allergic to any kind of food, and any kind of reaction to food drained my energy, and I was gaining weight for 5 years. So my weight was really high, and in 2016 I got to the emergency room twice with out of control blood pressure, and I had to do something, and I started a light labor program for myself, and in over a year I lost over 50 pounds, and now I went back to the gym, so I feel much better. Of course, a serious medical condition can come with all kinds of feelings, including depression, so I experienced it myself. Now, I was not suicidal, you know, but I thought I was going to just die because I was so sick. So, in my case, there was a linear connection between weight, more increased activity levels, and decreasing weight. However, as you can tell, it's not a straight line. So there were ups and downs, and there was weight loss, and then weight gain again, and weight loss again, but it kept going further down. Now, when you experience such changes, it means that you don't really know what's going on. Is it going to go back up? The fear is there. How it's going up? So is it going to go back up to over 200 pounds again? It's always there. So these things I experienced myself, and I and my staff members can pay attention to the experience, how people experience the program, the changes they are going through, and everybody will be instructed to pay attention to that. Overlapping factors in recovery and active aging. This I'm going to explain in the next video.